All right, so today we're going to break down the brand new 2025 guidelines on valvular heart disease. And look, our goal is simple, to translate all that complex medical advice into a clear, understandable journey. From the moment you get a diagnosis all the way through recovery. Let's dive in. Okay, think about your heart for a second. It's got these four little one-way doors, right? Their only job is to open and close perfectly every single beat, making sure blood flows forward and never ever backward. But what happens when one of those doors gets a little sticky, or maybe it doesn't shut all the way? Well, that simple mechanical problem is at the very core of what we're talking about today.
And yeah, that condition has a name, valvular heart disease, or VHD for short. This isn't about the heart's wiring or about clogged arteries. It's a structural issue. It's a plumbing problem, not an electrical one. And it's this disruption in blood flow that can cause symptoms and, if you don't address it, can lead to some pretty serious issues down the road.
So let's start our journey at the very beginning with the first and honestly the most critical step, getting a diagnosis. And the new guidelines really stress how important it is to see the full, detailed picture of what's going on inside your heart from day one.
The process usually starts in a pretty familiar way, with your doctor listening to your heart with a stethoscope. But from there, these new guidelines lay out a super clear path into the world of some pretty amazing imaging. It kicks off with an echocardiogram, which is basically an ultrasound of your heart, and then, if needed, it can move on to even more powerful scans.
And this is that advanced toolkit in action. The echocardiogram, or TTE, that's the essential first look. But if they need more detail, a cardiac CT can give surgeons a literal 3D blueprint of your heart for planning. And then there's cardiac MRI, which is kind of the gold standard for measuring just how much a valve is leaking and seeing how the heart muscle itself is holding up.
Okay, so with that crystal clear diagnosis in hand, you've arrived at a crossroads, a big one. And the latest guidelines make one thing absolutely 100% clear: you do not make this decision on your own.
And this is probably one of the biggest, most important shifts in modern medicine. The idea that a single doctor makes the final call? That's over. These guidelines are built around the idea that managing VHD is a team sport. It just has to be.
So who's on this team? Well, you've got your main cardiologist, of course, but you also bring in a cardiac surgeon, who's the expert in traditional options, and an interventional cardiologist, who specializes in those less invasive procedures. Then you add the imaging specialist, the person who gave you all those amazing pictures, plus nurses and others as needed. They all get together to talk about your specific case.
Now check this out. This is a direct quote from the guidelines, and I want you to focus on two words here: informed patient. That's you. Your voice, what you value, what you want for your life, it's a formal, required part of the process. The whole goal is what they call a shared decision.
So, the heart team's entire job is to take all the evidence from your scans, look at your overall health and lifestyle, and then lay out the best options for you. This is all about choosing your path forward, together. Let's use a really common example, treating a narrowed aortic valve. The team is probably weighing two main options. First, there's SAVR, which is the traditional open heart surgery. Then there's TAVI, a much less invasive option where the new valve is guided up through a catheter. The right choice? It's often a balancing act between things like your age, your overall risk, and whether the top priority is long-term durability or a much faster recovery. And that's really the crucial point, isn't it? The best path forward isn't just about what the science says in a book. It's this delicate balance. It's a combination of the hard medical evidence, the unique roadmap of your own heart's anatomy, and what matters most to you. And that brings us to our final act, the path forward. Because a successful valve procedure, that's not the end of the story. It's the beginning of a whole new chapter. So what does life look like after treatment? Well, the guidelines lay out a lifelong management plan. We're talking regular checkups, at least once a year, just to make sure everything's still working perfectly. Getting an echo soon after your procedure is huge because it sets a new baseline for the future. And then you've got things like cardiac rehab, managing medications, and maybe the most important part, you being aware of any changes and reporting them to your team. It's all part of the long-term plan.
When you boil it all down, the amazing imaging, the heart team, the shared decisions, the follow-up, it all points to one single powerful goal: to give you not just a longer life, but a higher quality of life through care that is built entirely around you.
So we're going to end with this question. The whole purpose of these guidelines, and really the purpose of us breaking this all down, is to empower you. You now know what the new standard of care is, you know about the heart team, you know about shared decision-making, and you know you have a central role to play.
So the only question left is, are you ready to use that knowledge?